Hi, my name is Aaron Paul Marquez, and today we'll be performing the Ambulating a Patient skills video. And to start off with, I have here my mom. And can we please confirm your full name, your date of birth, and if you consent to this skills video submission and recording?
My name is Mira Luna Marquez. My birthday is September 11, 1966, and I consent to this video.
Awesome, thank you so much. So with that, now we're able to continue with this skills video. And to start off with our supplies, we have here our Gait Belt and non-slip socks that we'll be using for this skills. And we also have hand sanitizer for hand hygiene. Alright, to start off, I would open and close the door behind me to ensure proper patient privacy. And then I would perform some hand hygiene to show the patient that we're staying clean. Then I will greet the patient. Hi, I'm Aaron. I'm your nurse today. Can I please see your right wrist? And can you please confirm your two forms of identification, your full name and date of birth?
Mira Luna Marquez, September 11, 1966.
All right, thank you very much. So with that, we're confirming the patient's identity, and now we're able to move forward and tell the patient what we're doing. So today the doctor's ordered some ambulating. With that, we're going to be using this Gait Belt and non-slip socks. And we would use this Gait Belt to wrap around your upper chest area and back, your torso area, and we would be just rocking you for about 3 times and lifting you up and taking a couple steps and sitting you back down just to do some ambulating. Is that okay?
Okay.
All right, and we're also going to be putting on some socks on you today, just so you don't slip or anything. Is that okay?
Okay.
Awesome. So now I'll be putting on these non-slip socks. And in doing that, I would also ask the patient if they have a strong or weak side. Do you have a weak side by chance?
The right.
Your right side? Okay. So now that the patient identified their weak side, I would be supporting the patient from the right side. All right. Both the right and left are on. So now that we have the non-slip socks on, okay, now we're going to be putting this Gait Belt on. And what's very important about the Gait Belt is to ensure that it's not tangled, it's not inside out, backwards on the patient or anything. Also to ensure that it's not tangled around the patient's gown. And just to also make sure that there's at least, you can fit a couple fingers to make sure it's not too tight on the patient. Okay, so I'm just going to be putting this around your upper chest area and your back, and we'll be rocking you for about 3 times and then we'll lift you up. Is that okay? So here, I'm going to ask the patient, can you please sit up a little? Thank you. And I'll be placing this on their upper chest and torso area and their back. And then ensuring that it is a snug fit, but not too tight, so that you can fit a couple fingers in between the patient and the belts. At least a couple fingers. Is that okay?
Yes.
Awesome. So now that the patient has confirmed that they're okay, now I'll be standing in front of the patient, and then we'll be rocking for about 3 times and then lifting them up and ensuring that I'm facing the patient and standing right in front and not to the side. Okay. So I'll be standing right in front of you. I'm just going to grab the Gait Belt and we're going to rock for about 3 times, and you're going to push off from your hands, and I'm going to help lift you up. Is that okay?
Okay.
All right. Ready? 1, 2, 3. Awesome. We're up. Do you feel any dizziness, nausea?
No.
Okay. Now I'll be supporting the patient from their weak side, which is the right side. I'll take their hand. And can you please face forward, just so that there's no obstacles, anything? All right. Now that the patient is facing forward, we'll be able to walk now. So we'll just take steps on your pace. 1, 2, 3. Now we'll turn around. Okay, 1, 2, 3. Turn around again. And ensuring the patient's the back of the knees are touching the bed, the chair, and facing the patient always when I sit them back down. Ready to sit down. Ready, 1, 2, 3. Sit down. Do you feel any dizziness, nausea?
No.
Okay. Now that the patient's confirmed that they're not dizzy and that I what's always important is to, whenever you're lifting or sitting the patient back down from a gait belt, that you stand right in front of them. Okay. Now I'll be taking off the gait belt and the socks. Is that okay?
Okay.
Okay. So starting with the gait belts. So, thank you. Place that to the side, a safe place. And taking off the socks. Socks. And also starting that. Okay. And also performing proper hand hygiene before leaving the room. Now we thank the patient. Thank you. I will chart that you've done some ambulating today to the doctor. And you're all set. Thank you.
Thank you.
Thank you. And I open, close the door. Thank you.